So welcome. Good evening. My name is Nikki. I'm the program director here at Wellspring, Alberta, and we're so glad you could join us for tonight's session. I do want to start with our land acknowledgement. So our health and well-being are connected to the land and the environment that surrounds us. We acknowledge that the land we share, learn, and live on are the traditional territories in Alberta of Treaty 6, Treaty 7, and Treaty 8. This is also the home of the Métis settlements and the Métis Nation within Alberta. Here at Wellspring, we are both settler and Indigenous, and we pay tribute to those whose footsteps have marked these lands for centuries. Wellspring acknowledges the traditional healing pathways and knowledge of our interconnectedness with the land as gifts provided by elders and knowledge keepers. Throughout the year, Wellspring offers more than 70 evidence-informed programs that address the emotional, social, practical, and restorative needs of people living with cancer. These programs are offered free of charge to our members and without referral. Our mission is that no one has to face cancer alone. Living Your Best is a collaboration with Cancer Care Alberta and Wellspring Alberta. And for a short bio for our speaker tonight, Dr. Kevin St. Arnaud is a clinician, lecturer, and researcher. He is currently an assistant clinical professor of palliative medicine at the University of Alberta. Dr. St. Arnaud has specialized training in psilocybin, ketamine, and MDMA. And Kevin, apologies if I mispronounced any of those. They're all assisted psychotherapies with providing psychedelic therapy in private practice. He's taught both graduate and undergraduate courses in clinical psychology. So we're truly delighted, Kevin, to have you join us here tonight. And with that, I'm going to pass it over to you.
Great. Well, thanks so much for having me, Nikki, and hello to everyone this evening. It's really lovely to be here. And yeah, I'm very excited tonight to speak about an area that's a real passion of mine. And that's psychedelic-assisted psychotherapy, of course. And there's a lot of use cases for psychedelic-assisted psychotherapy, and we can chat about that more broadly. But of course, here tonight, I'm here to speak about this particular area, which is in advanced cancer, in advanced illness, and the very unique effects that this modality can have to help out individuals that are in this phase of life. So I suppose I can jump right into it, and we can go from there. And if you have any questions, Nikki, are we do questions during the presentation, or would we wait till the end? Would that perhaps be more expedient?
Because we're recording, let's hold it off till the end.
Right. Okay. Of course. That for privacy, that makes sense. Okay. All right. So I'll just share my screen here. All right. Okay. Can everyone see that okay? Perfect. Just gonna adjust some things here. Okay. So kind of starting at the beginning, looking at this question and this idea of existential distress in advanced cancer. And so what is that exactly? And you know, who experiences it and these kinds of things. We're going to look at that first. So what the research suggests is that this form of existential distress that's experienced by many, but not all, but many individuals that are contending with more advanced forms of cancer and other forms of life-limiting illness, that it can be very difficult to manage, and that it can essentially cause a great deal of suffering, a great deal of suffering for individuals. And I think it's also important to separate out explicitly existential forms of distress from other forms of psychiatric or psychological distress. Existential distress, it has a real specific quality to it that overlaps with others, but is unique. It's a special kind of area. And so what that might involve is a sense of loss of meaning or loss of purpose in life, feeling a sense of hopelessness, depressive symptoms, feeling as though one has become a burden on others, feeling greatly demoralized in life, feelings of anticipatory grief, death anxiety, and spiritual forms of distress or other forms of distress that are kind of related to these broader existential questions of meaning, purpose, isolation, and freedom, and these kinds of really, really big topics. So unfortunately, what we know as psychologists is that despite its severity and its importance for many patients, it often is insufficiently addressed. And that's because there's not a whole heck of a lot of interventions that have shown unequivocally effectiveness. There are certainly some forms of psychotherapy, and some individuals benefit from those forms of psychotherapy, but a great deal of individuals do not benefit. And contemporary psychopharmacological medications are also shown that though they can impact depression and anxiety in some individuals, this special area of existential distress doesn't seem to be impacted by traditional forms of psychopharmacology. And so that's, of course, where psychedelic-assisted psychotherapy comes in. There was historic studies that were initially done back in the 1960s and into the 1970s that were looking at this modality for individuals with advanced cancer and other life-limiting illnesses. And this research has continued today more recently and showing some real promise for helping individuals that are contending with these challenges. So what are psychedelics? Well, first of all, they're amongst the oldest psychoactive substances with known use by our species, by human beings. Their use goes back many thousands of years. And anthropologists that have studied this have seen that essentially every single human culture that's had access to psychoactive plants has used them. So if we've had them, we've used them. And for what purposes? Well, for spiritual purposes, for healing purposes, and for the sense of social cohesion, for creating a culture, creating a group. What does it mean? So psyche means soul, and delos means to reveal or to show or to bring to light. And so this word usually means mind manifesting or soul revealing. I really like that term soul revealing. We'll see why that is and why that's particularly pertinent for helping individuals with existential forms of distress in particular. Okay, and so I really like this description by Jaffe to kind of give us a sense of, well, what do they do? What is the effect of this drug? Because all drugs kind of affect us in different ways. And so Jaffe says this: the feature that distinguishes psychedelics from other classes of drug is their capacity reliably to induce states of altered perception, thought, and feeling that are not experienced otherwise except in dreams or at times of religious exaltation. So dreams or religious exaltation, that already kind of clues us in on what the changes in consciousness that these substances can induce might look like. And certainly there's a variety of states of consciousness that these substances can evoke, but this is, I think, a really great kind of catch-all to give us a general sense of the picture. So what are the different kinds of psychedelics, and which ones do we use? So many different drugs are considered, broadly speaking, mind manifesting or soul revealing or mind expanding or consciousness expanding. These are all kind of synonymous terms for psychedelic. But perhaps the most well-known are the so-called classic or classical psychedelic substances. And in there you have psilocybin, which is the active ingredient within so-called magic mushrooms or psilocybin-containing mushrooms, which are found all over the world, and their use goes back many thousands of years. You have LSD, of course, which is a more modern form, a synthetic form of psychedelic substance, although there are many forms of naturally occurring psychedelics that are very similar to LSD that grow on essentially the fungus of a variety of different species, including wheat and barley. There's certain kinds of ergot fungus that creates very similar forms of substance to LSD. There's dimethyltryptamine, which is the most potent psychedelic that we've thus discovered, and it's found in a brew that's used all over South America and up into Latin America called ayahuasca. and it's used today by many different churches and many different traditions, religious traditions across South America, and now those are branching out throughout the world. And then there's mescaline. Mescaline is found in peyote cactus and as well in San Pedro cactus. Mescaline is used by the indigenous peoples of the United States and northern Mexico, and it continues to be used today in various syncretic religions, which are mixes of traditional indigenous spirituality with Christianity, and they've incorporated the use of peyote. And so that's done legally to this day, and it's a kind of a continuing tradition. So those are the so-called classic psychedelics. Then we have the empathogens. The most famous is MDMA. And so the empathogens are similar to the classic psychedelics, but they have more of an amphetamine property and more of a connectiveness property. So they're often used to facilitate that sense of warmth and interpersonal connection. We use those in the treatment of post-traumatic stress disorder with great results. And then finally, we have various so-called atypical psychedelics. One of the most prominent there that we use is ketamine. Ketamine is technically a dissociative anesthetic, but when it's used at low doses, it has some very, very powerful antidepressant, anti-anxiety, and psychedelic properties. So these are the various substances, and currently in Alberta and in Canada more broadly, we have access to ketamine, and then through special pathways, we can access MDMA and psilocybin. So to understand psychedelic substances and the effects that they would have on a given individual, we really, really have to understand these two terms, set and setting. Like most drugs, and certainly like most psychoactive drugs, to understand the impact of a drug on a given individual, you really, really, really have to understand the nature of the set and the setting. A great example would be even a very commonly used psychoactive substance or psychoactive drug like alcohol, for example. There's going to be a great difference in terms of how alcohol impacts an individual. If an individual is at, let's say, a wedding, maybe they're using alcohol there. That might look different than a dinner party with friends with a glass of wine. That might look different than a night out at a bar. And that might look different than just drinking by oneself, let's say, at home. Those are all perhaps different sets and different settings, and they're going to impact the nature of the experience with the drug. And so when it comes to the psychedelic drugs, these variables get even more important than they would be with alcohol, for example. So what is set? So that includes the intention. In other words, why are you taking this drug? Why are you using this substance? What is your personality structure? Are you a very rigid person? Do you kind of really hold on tight, have a high need for control? Or are you a little bit more loose and a little bit more easygoing? Intelligence and cognitive functioning, that can come into play in terms of set, and also finally your emotional state. Are you really anxious? Are you really worried? Are you happy? Are you down? Are you depressed? Are you excited? All of those different variables come into play when understanding what is the set of the individual that's approaching the use of the drug. And then setting is, of course, where are you physically? So are you in a cozy living room environment, like in the top picture here on the slide, we see this kind of welcoming environment, or perhaps are you in more of a clinical environment that we're seeing in the bottom picture on the slide here? Socially, where are you? Are you with people that you really know and trust, a close friend? Are you with a therapist or a doctor? Or are you at a party with people that you've never met before? And then cultural, which is just how does the particular cultural context understand the changes in consciousness that the drug might bring upon you. So we really, really have to understand these. They are absolutely central to determining the outcome of a psychedelic drug experience rather than secondary. So we really, really can't underestimate these. They're critical, and they are really hyper contrived when it comes to psychedelic-assisted therapy to ensure that the individual has a productive and healing experience. Okay, so here we see a picture of a therapy room. I believe this one is at Johns Hopkins University. I could be wrong on that. I believe that's where this picture is taken from. And we can see that this is a pretty cozy environment. There's a rug. The two psychotherapists that are present are dressed in kind of just standard cozy clothes. And the individual there is lying down. They have a nice blanket on. They have an eye mask on. And then, of course, they have the headphones on. And this gives us a sense of what the setting will look like for psychedelic psychotherapy. It's really, really important as well to understand that these drugs aren't taken like many other drugs that we take, where an individual might receive a prescription and then go on their way and then kind of take one in the morning and one at night or whatever it might be. These drugs are used to augment the process of psychotherapy. So really the drug is just a catalyst. It's just enhancing the normal process of, well, it's not exactly normal psychotherapy. It's kind of a specialized form, but really that's what it's all about. So it's not what we'd call a pharmacotherapy. It's a psychotherapy augmented or assisted by the altered state of consciousness. There's two kinds. There's a psychedelic psychotherapy, which is what we tend to use particularly in context of advanced cancer. And then there's psycholytic therapy, which has more to do with lower doses, where we're just trying to enhance normal psychotherapy, normal talk therapy. So the individual's not necessarily lying down with the eye shades on. They're just loosening up their mind a little bit for enhancing therapy. So typically we're in the advanced cancer arena, we're doing psychedelic therapy, which is a little bit higher doses. We're trying to evoke certain kinds of experiences, which we'll speak about here in a moment. So what should an individual expect if they were going to go ahead with psychedelic therapy? So first, they would be meeting with, well, first the psychiatrist on our treatment team that would go through a full and comprehensive medical screening to make sure that they were appropriate for the treatment, that it was physically safe for them. And then once that they were checked off for that, then they would come and they'd meet with me, for example, and they would do now some psychological pre-dosing sessions where we do everything that we do in normal psychedelic or a normal psychotherapy, where we develop rapport, we develop trust, and we also get a sense of what the individual's struggling with, what their challenges are, what their symptoms are, and what their intentions are for the treatment, what they're hoping to get out of the treatment, and really developing that relationship. Typically, there are, as you can see here, there's two therapists, or there will be a therapist and a nurse present. So there's always two people present with you in the room. And then on the days of the dosing, like we see in this picture here, the individuals, of course, lying down, they ingest the medicine, they're encouraged, though they're not required, to put on their eye shades. And then in the headphones, this is really important, they're listening to a beautiful instrumental playlist. There's no lyrics typically, or if there are lyrics, they're in a language that the individual doesn't understand. And the idea is to go inward, to focus on your inner experience. So the therapist there, as we can see with this therapist, she's holding on to this individual's hand just to give that sense of support that, yes, you're here, you can do this, you can go inward. And so it's really this non-directive approach where we talk about the so-called inner healer, that we're going inward, we're having novel experiences, we're having very big and powerful experiences. And the therapists are just there. We're not guiding the session. We're really supporting and kind of creating this safe context where anything that needs to be expressed or said can come out without judgment, without fear. So it's about support. And so the big mantra in psychedelic therapy is trust, open, and let go. Trust, open, let go. Another big word is being able to surrender, relinquish control to the experience rather than resisting what comes up. It's very important that we're able to just essentially float on downstream. Very key. And then finally, we have the so-called post-dosing integration sessions, where now you would come back the next day or the next day after that, and work with one or both of the therapists to say, what was that all about? And how do I make sense of that? And how do I want to take that forward and in my life be different or look at things differently because of that powerful experience that I had? So that kind of gives you a broad overview of what a typical course of treatment might look like. So before we get into kind of some more depth in terms of the experiences, we'll talk a little bit about what might be some of the risks and who's contraindicated, who might not be appropriate. The classic psychedelic drugs in particular, and so psilocybin, LSD, and though psilocybin, of course, is, as I mentioned, it's the main one that we have access to in Canada of the classic psychedelics. Very, very safe drugs. Very, very, very safe drugs in a physical sense. They don't have a whole host of impacts on the body. There's no physiological or cognitive toxicity to these drugs. They're not found to be addictive. In fact, there's a whole host of research showing that these can be used to treat chronic and intractable forms of addiction to things like nicotine or to opiate medications. Um, so they are very, very safe overall. But they certainly, like any drug, like any substance, they certainly do have some risks. Um, the risks tend to be more of a psychological nature, that they can induce a strong sense of anxiety and some fears where things that bubble up that maybe that we know that we need to look at or know that we need to face and work through, but maybe are, a little bit apprehensive. Well, those things can start to bubble up for us, which is precisely the utility of this treatment. But that can induce a sense of, whoa, like this is kind of scary. And so, of course, that's why the therapists are there with you. They do cause some minor or some small increases in heart rate and blood pressure as well. So for some individuals, that can be a contraindication. In some individuals with a history, a personal history or family history of epilepsy, they may induce seizures. The research there is still a little bit still dubious, still being sorted out, but nonetheless, there could be a risk there. And so then what are the contraindications then? Who would we say is perhaps not appropriate? So if an individual has a psychotic disorder, a so-called psychotic disorder, or a family history of schizophrenia or other psychotic disorders, then they may not be an appropriate fit for this treatment. If an individual has serious and untreated cardiovascular illness, that might be a contraindication, would have to be discussed with the psychiatrist. If an individual has a very serious or untreated seizure disorder, that might be a contraindication. If the individual is using already an SSRI type medication or a standard antidepressant, that could potentially be a contraindication due to serotonin syndrome or just due to the blunting of the effects, because they both work on serotonin. Psychedelics work on serotonin, as do, of course, the SSRIs. Use of haloperidol may lead to some dissociative type symptoms or some anxiety symptoms. And then same thing with the use of lithium. There can be some potential dangers there, though that's not necessarily fully substantiated. But I think it's just good to get a sense that this is not necessarily going to be appropriate for everybody, although they, as a rule, are very, very, very safe medications for most people. Okay, how are we doing? All right. All right, so let's look at a little bit of the research then on psychedelic therapy and existential distress. So as I mentioned, this research goes back to the 1960s and 1970s initially, and there were some really cool groundbreaking studies that showed that this could help palliative patients, patients with end-of-life distress, and individuals with advanced stages of chronic illness as well. There were some methodological flaws in the studies at the time scientifically, but nonetheless, they really pointed in the direction and there were some really pronounced effects. More recently, there's been this upsurgence of interest, this renaissance of psychedelic research and psychedelic clinical treatment, and a recent systematic review and some recent meta-analyses, which are kind of like studies synthesizing many studies, are showing that LSD, psilocybin, ketamine, and potentially MDMA have some efficacy in treating not just psychiatric or psychological distress, but also, as I mentioned, this key piece, this existential distress in these individuals with advanced cancers and some that are, of course, in palliative status. What did they find? What does this research show? We're seeing decreases in anxiety, decreases in depressive symptoms, decreases in a sense of meaninglessness, decrease in a fear of death or death anxiety. We're seeing decrease in pain, which is a very interesting piece. And this makes sense given what we understand about what's so-called total pain. And of course, the fact that pain is an experience that's generated with the emotional centers in the brain to create this phenomenon that we call pain. And so a lot of individuals find that as they work through different kinds of pieces, their pain symptoms also change, which is, I think, also really exciting. Hopelessness goes down, and also we see a decrease in the desire for a hastened death, so a decrease in the desire for something like medical assistance in dying, which is also an intriguing finding. And we see increases. We see an increase in patients' reported quality of life, in their sense of meaning in life, in their sense of death acceptance, greater life satisfaction, greater reported spiritual well-being, and greater reported existential well-being as well. So a lot of really, really promising outcomes are being demonstrated in these studies. And importantly, they're seeing that there's no, in the studies, the clinical trials are showing no serious adverse events, that as expected, there's some minor increases in heart rate and in blood pressure. Some individuals experience transient headaches or some nausea, and certainly some individuals experience some fear or anxiety. But all of those effects were found to be transient and did not require intervention. So the support of the therapists and the treatment team was enough to help them get through some rocky patches. And as the drug effects faded, these symptoms faded as well. So they were considered not to be overly severe. Okay. So this is where things get really, I think, really intriguing. We go, why? Why psychedelic therapy? Why these mind expanding, or why these soul revealing drugs? Why would we be using them? And more broadly, why is our species, why have human beings used these things for millennia? Why is that? And the so-called psychedelic-assisted mystical experience is a big part of it. So what we know is that it's these changes in subjective experience, changes in consciousness that can be brought on by psychedelics, given the optimized set and setting, the right music, the cozy environment, the dim lighting, all of those kind of things, a sense of trust and safety. So of course, we assume all of that's there, and it must be there. To evoke a certain state of consciousness or change in consciousness and certain experience. And that experience is shown to be critical to the therapeutic outcome. So it's not just, oh, I take the drug and I experience these changes. No, I took the drug in the right set and setting, the right experience was then had, and those certain qualities of experience then lead to certain clinical outcomes. That's currently what the research is suggesting, though in time, that as we learn more about these drugs, that might change, but that seems to be where we are currently. What the research shows is that certain kinds of experiences then have been demonstrated to predict positive outcomes. All of those positive outcomes we looked at on the previous slide. So there's the mystical experience. There's a sense of connectedness that people experience, connectedness with others, connectedness with their deep self, connectedness with something that they experience to be divine or sacred or transcendent. These so-called emotional breakthroughs or emotional catharsis, feeling and working through some pain that maybe they've been carrying along with them for decades, that breaks through and they're able to have a work through of that and let that go, unburden themselves from it. And then also self-insight and greater sense of flexibility, lack of less rigidity in thinking can often come out of these experiences. And it's all those kinds of experiences that predict these enduring benefits for patients. What we see that amongst the most therapeutically resonant, and particularly amongst the most therapeutically relevant for individuals with advanced cancer, are the so-called mystical type experiences that I've been alluding to here, the mystical type experience. So what is a mystical experience? A mystical experience involves a number of key phenomenological effects. So first, there's this great sense of unity. I feel this great sense of oneness with everything, oneness with the earth, oneness with something that's experienced as divine or transcendent, oneness with the universe, oneness with God, oneness with nature, you name it. It's a oneness with whatever someone perceives to be beyond or transcendent. There's this pronounced sense of awe, this utter sense of awe and the unfathomable sense of the numinous, this reverence of this being overwhelmed by something just vast and huge. There's this sense of authoritative truth of the experience is more real than real. Individuals report that when they're in a mystical state, they say, though this is the fake reality. When I was in that reality, that was real. We sometimes call that gnosis, this sense of just, I downloaded knowledge. I saw the truth of all being, of all reality. There's pronounced positive mood, love, joy, more powerful than anything that anyone's experienced before in their life. There is a sense of transcending time and space. I was outside of time and space. Those no longer meant anything anymore. I was in an eternal now. I was in a sense of pure bliss, a oneness with all, and that is a space outside of time. There's also this sense of ineffability in the mystical state, which means I can't put it into words. I come back and I'll try. This is the best I can do, but really you just can't describe it in words. It was unlike anything I've ever experienced before. And then finally, there's this sense of paradoxicality, which is a very powerful effect here too. Paradoxicality is where oftentimes our mind thinks in dichotomies. There's black and there's white. There's right and there's wrong. There's good and evil. When we're in a mystical experience, those polarities combine and we see that, oh no, those all hang together. We call it a non-dual experience. Normally, our mind works in duality. These are non-dual experiences, which meditators the world over are searching for non-dual experiences. And paradoxicality is a chief component of that, where all things are held together. Life and death, black and white, good and evil, it all just makes sense. There is no dichotomy. It's all together. So that is the so-called mystical experience. And actually, I'll just go back here. Mystical experiences in particular have been shown that the degree to which an individual experiences that sense of unity, that sense of awe and reverence, that sense of truth, of this immense joy of transcending time, that paradoxicality, the degree to which a person reports those phenomena, that predicts the degree of clinical enduring benefit. So it's really, really intriguing that we really want to get that kind of experience, though we can't predict it. But also we should say that this sense of connectedness, these emotional breakthroughs, this flexibility, those are also really important too. And so it's not only the mystical experience, but this is one of the really big ones that's been shown particularly for individuals with advanced forms of cancer or life-limiting illness. So in part, why might that be? Well, experiencing a mystical state is what's considered a self-transcendent experience, a going beyond my normal sense of self, this expansion of who I think I am and what I am, this expansion of consciousness. And we see that these experiences might lead individuals to cultivate a greater sense of feeling more self-transcendent in their normal day-to-day, or feeling more spiritual in their normal day-to-day. And I think here is really important to differentiate spirituality from religion, okay? Many people that are religious experience their spirituality through their religion. And that's wonderful, and that's tremendous. But spirituality is not limited only to those that are traditionally religious. Many people can identify as an atheist or as agnostic or as spiritual but not religious. So everybody has access to these so-called self-transcendent or spiritual states. And that's not the exclusive realm of only the traditionally religious. And so that's a really, really important piece. Anyone can feel a sense of unity with nature or with the cosmos, with the universe itself. It doesn't require any form of metaphysical belief because it's an experience. It's not faith, it's experience, okay? And that's really, really important to differentiate that. So individuals develop this greater sense of spiritual well-being. They develop a greater sense of spiritual transcendence or self-transcendence. And what these predict are greater quality of life, lower anxiety, lower depression, and greater overall just sense of well-being, psychological well-being. And why is that? when we feel ourselves as part of something bigger than ourselves, something that goes beyond ourselves, that preceded us and will go much beyond us, there's a sense of continuity and a sense of meaning that we develop. And this gives us this move towards what we call a meta perspective that begins to transcend our own life and therefore transcend our own death. We relativize ourselves when we feel how huge and vast the universe is and how small we are. It doesn't make us feel ashamed or bad or insignificant. Quite the opposite. It shows us that we are a critical part of something much bigger that will go beyond us and will transcend us. And this really leads to that sense of comfort and ease and reduction in anxiety. And this is this idea of so-called death transcendence, which is associated with lower anxiety, lower despair, lower fear of death, and a greater sense of acceptance and equanimity in the face of, well, these big existential questions. Okay. So let's look at some patient experiences. I've mentioned a lot of the research that's been done here, and a lot of the research uses math, statistics to see are there, outcomes and treatments and all that kind of stuff, and that's great. But there's been a number of what we call qualitative research studies that actually ask participants for their direct feedback to say, tell me about that. What was that like? And let's look at some of their experiences that come out of this research. So most patients in these clinical trials, they reported this loss of their boundaries, this expansion of their sense of self, and that sense of connection and unity or oneness. So that's the core of that mystical experience as we talked about. And they attributed those types of experiences with that sense of relief, with equanimity, with a sense of acceptance, and that things are going to be okay. So here's one. So this one patient said, the psilocybin just opens you up and it connects you. It's not just people, it's animals, it's trees. Everything is interwoven, and that's a big relief. I think it does help you accept death because you don't feel alone. You don't feel like you're going to, well, I don't know, go off into nothingness. That's the number one thing. You're just not alone. That's one really beautiful quotation. Another patient in the trial said, I experienced the feeling that one is eternal and that all of existence happens in every moment. Another said, I felt like this was really dealing with death. I'm in the forest and there's this beautiful green, lush kind of woods, and I'm down below the ground, and it felt really, really good. And I thought, that's what happens when you die. I'm going to be reconnected with this beautiful world, this earthly world that we live in. It was just simple. It was gorgeous. And another said, I felt this constant state of becoming. I felt gratitude like I have never felt before in my life. I felt totally welcome. It's really, really powerful. Okay, so what are some of the regulations? How do we ensure safety? So what's really exciting is that for those of us in Alberta, um, we have the first legislation on psychedelic medicine in the country. Now, this came into effect on January 2023. And there's pros and cons to regulations. There's pros and cons to there being a legislation and laws now in place. And I'll explain what I mean. So what are some of the rule sets here? So any clinic that wants to offer psychedelic-assisted psychotherapy must first be licensed by the government of Alberta, and they must have the medical oversight of the psychiatrist. There must be a medical director who is a psychiatrist that runs the clinic, that has oversight of every patient that goes through the clinic. Only a psychiatrist or another physician that's consulting with that psychiatrist is actually allowed to prescribe the drug used in the treatment. So there's a very, very high bar there, and that psychiatrist has to have training in psychedelics. And then the individuals that are actually then receiving the psychedelic medicine in the psychedelic psychotherapy, they have to be monitored the entire time by regulated therapists or nurses with specialized training in psychedelic-assisted psychotherapy, or PAT for short here. And so what that ensures, and why that's good, is that it means that if an individual is going through the process, they can be relatively sure that everyone there kind of knows what they're doing, has the right training, is crossing all their T's, dotting their I's, and that they will be safe, that they will be well taken care of. The downside of this, of course, like any regulation, is that it's a bigger bar, a barrier to entry because of that. It's not as accessible necessarily. Eh, because there's a lot of regulation to access it legally. So in the rest of the country, there's different parameters that exist, and it's a little bit more open and loose. And again, there's pros to that, but there's also cons to that. So that's the current status of things currently here in Alberta. And yeah, I mean, I guess that's it really. In terms of the clinics that currently offer this treatment in Alberta, there's where I'm currently working here in Edmonton at it's called Reunion Psychedelic Therapy. But there's a number of clinics in Calgary and in Edmonton. I don't know if there's any outside of those two major centers. I'm not sure if Red Deer or Lethbridge have any psychedelic psychotherapy clinics yet, but I could be wrong on that. So the options are coming. Yeah, if you're interested, feel free. You can email me. If you're interested and want to learn more, I'd also recommend taking a look at I think one of the biggest advocacy groups in Canada. They're called Therasil, and they're doing a lot of great work there. They're based out of Victoria and Vancouver. They're wonderful. I did my training with psilocybin through them, and they're a great advocacy group. There's also MAPS Canada, the Multidisciplinary Association for Psychedelic Studies, and there's the Canadian division. So you can go to both those websites if you'd like to learn more as well. So yeah, I mean that brings us to the end here, and yeah, I wanted to make sure that we had ample time for kind of discussion, for questions, those kind of things, so we can go from there. So I'll stop it here.
Dr. Anand, thank you so much. I'm just going to pause sorry, not pause. I'm going to stop the recording.